I have 9 o'clock, and we'll call the March 17th, 2025 Board of County Commissioners meeting to order. At this time, Vice Chairman Thomas, will you lead us in an invocation?
Let us pray. Our most kind and dear Heavenly Father, we come to you today grateful for the opportunity to be here in a free country, God. God, we ask you to be with all the sick and the suffering, God. Be with the ones that have lost loved ones, God. God, we ask you to be with all our sheriff, our fire, our police, our EMS. God, be with each and every person that answers the call when the call comes, God. And just watch over them. Keep them all safe. God, we thank you for allowing us to live in a free country, God. We thank you for watching over our troops that are keeping us safe abroad. God, we ask you just to be with this board, help us make wise decisions. And God, we ask you just to forgive us of all our sins. In your heavenly name I do pray. Amen.
Amen. And Commissioner Royster will lead us in our Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Members of the board, you have the agenda before you. Is there any discussion or adjustments to the agenda? Having hearing none, do I have a motion to approve the agenda?
I'm sorry, I was a little slow on that. I just point out that we have 2 number 6s, and there's a couple things I'd like to pull from the consent agenda.
Okay, what items would you want to pull from the consent agenda?
C and E. I'm sorry, B and E, Budget Amendment 16 and the reimbursement agreement.
All right, members of the board, we are moving item B and E from the consent agenda, and we will add that as item 8, after item 8D on the agenda.
7D.
I think he's moving it down because we have 2 number 6.
Yeah, we're moving it down. All right, any other adjustments? All right, having hearing none, do all in favor vote by saying aye. Any opposed? The ayes have it. The motion's approved. At this time, we have a resolution of appreciation for retired Deputy Sheriff Charlie Oakley. All right, Charlie. We have the resolution of appreciation. Whereas Charlie Oakley served the people of Person County during his employment with the Person County Sheriff's Office, and whereas Charlie Oakley served the citizens of Person County with honor, integrity, sincerity, and dedication for 21 years. And whereas Charlie Oakley earned the respect and admiration of all who have known him and worked with him throughout his career. And whereas the County of Person recognizes the many contributions Charlie Oakley made to the county as a detention officer, a deputy sheriff, an investigation sergeant, a sheriff unit supervisor, and a deputy sheriff special assignment warrant K-9 deputy, and offers him the sincere best wishes in his retirement. Now, therefore, I, Kyle Puryear, Chairman of the Board of County Commissioners, do hereby extend this resolution of appreciation to Charlie Oakley for his dedication and commitment and for continually striving to make Person County a better place to live. And I ask for this to be adopted by this board on the 17th day of March 2025. Do I have a motion?
So moved.
All right, we have a motion. Any further discussion? All in favor of the resolution, vote by saying aye. Aye. Any opposed? The ayes have it. The resolution is approved. Charlie?
Yes, sir. I appreciate you.
Thank you, sir.
very much. Thank you.
Thank you.
Thanks, everybody.
Charlie, you want to say any words?
It's been a pleasure and honor to serve Person County. It's been a lot of hard nights, tough days, but it's been great working for the sheriffs of Person County. Dennis Oakley hired me in '98, and came through the ranks with Sheriff George Jones and now Sheriff Jason Wilson. Fine men to work for. Thank you, appreciate you.
Well, thank you. Wish you the best in your time. Thank you. All right, at this time, we have our informal comment period. Madam Clerk, has anyone signed up to speak?
Yes, Mr. Chairman, we have one individual.
Okay. You can go ahead and call that individual up.
All right, Ms. Keisner.
Good morning.
Good morning. I'm Jana Kisner. I'm the current chair of the board of Person County Friends of the Parks. And I'm here not only personally to offer my full enthusiastic public support, but also on behalf of the Person County Friends of the Parks in support of the Rail Trail multimodal feasibility study that John Hill will be presenting in a few minutes. The Friends of the Parks are grateful for the Commissioner's support of Roxborough Rotary Centennial Park, and we are working hard to have an opening soon. For months, even through the winter, our Friends of the Parks community volunteers continue to show up for volunteer work days. This new park will be a huge step to filling the void of public hiking, biking, and trail opportunities in our county. It's already putting us on the maps as Person County works to capitalize on something Person County has in abundance: outdoor beauty, adventure, and rural green space. But today I'm here as a witness of the public support for the next step, which is the Rail Trail multimodal feasibility study. Last summer at our Friends of the Parks Personality Festival table, we heard widespread public interest and support and enthusiasm for the opening of the new park and for expansion of recreational opportunities. We were frankly surprised by the level of interest and the numbers of people we talked to at the festival. Last spring, it was an honor to serve on the City Pedestrian Plan Steering Committee in collaboration with the NCDOT and the county. And at the well-attended public hearing held at the Kirby last spring, we heard enthusiastic public support as the community viewed the new maps for walking, running, and bicycling. The maps the public viewed included the rail trail that would connect the pieces to the larger network. And our Facebook and Instagram pages continue to have wide public interest and engagement, and you can find out more about the public's response and interest in all of these things on our social media platforms for Person County Friends of the Parks. Although there is some dissent and fear about a greenway, there is a much larger widespread community support for the future of parks, greenways, trails, and recreation. It's a worthy and a much needed investment, not only in the health and well-being of our citizens, but in the economic development of our county. The economic development benefits of a trail system cannot be underestimated. Even the smallest villages have experienced economic awakening and vitality from participating in the growing network of greenway and trail enthusiasts. But to realize the full economic benefit, the various pieces need to connect. They need to connect to the larger network. A rail trail would be that connector to the larger network and the greater economic development benefit. So personally, and on behalf of Friends of the Parks and the health and well-being of our citizens and the economic development potential, we are asking you to give your full support to the multimodal feasibility study. Thank you.
Thank you.
Mr. Chairman, that concludes informal comments.
All right, thank you. All right. Item number 7, discussion adjustment of the consent agenda. Do I have a motion to approve minus item B and item E?
So moved.
All right, we have a motion. Any further discussion? All in favor, vote by saying aye. Aye. Any opposed? The ayes have it. The motion's approved. Under new business, item 8A, multi-model trail feasibility study, John Hill.
Morning, Commissioners.
Good morning.
Hope you all are doing well. So I'm here this morning to present with Matt Hayes from Alta Planning Group, the Person County feasibility study for trails and multimodal sidewalks in Person County. Just to give you some background in your agenda abstract, so in 2022, NCDOT was given $2 million, was allocated $2 million from the General Assembly to spread out throughout the state in different communities and cities for feasibility studies for multimodal trails and paved sidewalks. And in 2003, I came to this board and requested that we would apply for the grant. The grant was administered through the Carter Council of Government, and this board approved to move forward with the grant for the feasibility study. We have been in that process for about a year now, a year and a half, and we finalized that study in August, and since then the study has been published. It has been adopted by the Recreation Advisory Board for their support, and it has been published on our website for public viewing and comments and so on and so forth since August. And before I allow Matt to go through the document with you, or before he generously goes through the document for because he knows it in and out better than I do. Just to let you know, this project, or this has been in, I guess, the crosshairs of Person County well before me. So I've been a part of looking and trying to understand the railroad corridor and how that fits into the greater connectivity of Person County and equity of parks and resources and things like that since 2000. But the people before me, the directors before me, were already looking at that well into the early 90s, just to let you know how far it's come along. So having said that, we are at this point now. We do have a finalized feasibility study, and I'm going to shut up and let Matt explain it.
Thank you all very much for having me. Matt Hayes with Alta Planning and Design, just down the road in Durham. So been excited to work on this project with you all. Bear with me. I think we've got the longer version of the presentation when we had a shorter version. So I'll probably skip through a few slides just to be cognizant and respectful of your time. But I just want to spend some time talking about the background, how we got here, what the process we went through, and comparing some of the trail alternatives, and then our implementation strategy. Just want to appreciate John just being such a great partner for us for this project, and working with him and his group and the county has been awesome. Wouldn't have this without NCDOT funding the project and John being right on the spot to go get that money and be able to bring it here to Person County. So DOT was a big supporter of the project, obviously, and really helped to guide this, a number of studies around the state. It's been a growing movement around the state. If you guys have followed the Great Trail State, have you seen any of those billboards on the highways? Big push across the state and legislation. And the thing I like about trails is that it's something that we can all rally around. It's not a red or a blue thing. It's something that's really, really exciting for everyone. And been a lot of focus on economic development and what it brings to North Carolina. And as you can see, it's evidenced by all these partners that were involved in this process. The East Coast Greenway, which actually is a part of this trail segment that runs from Maine to Florida, and that's slowly getting built out. And imagine people stopping from all over the country in Roxborough to get lunch, for example. So I think there's a lot of economic development opportunity with the project. So to John's point, we got started back in 2023, and I think, I'll walk through this in a little bit more detail, but it's really important for us to hear from the public and make sure everyone had an opportunity to participate. I think that's something we take seriously. But real important to get out there and see what's on the ground, what in terms of existing conditions, and then get that final study done. We created a division as a steering committee that was formed. We had folks from the city of Roxborough and a lot of engagement from Timberlake area and the county and others. And really the entire idea was economic development, transportation, health and wellness, I think, is another thing that's real important, giving people those opportunities for free access to exercise and outdoor exercise, and do it safely. I think, we have an opportunity to get bicyclists and pedestrians off of the road onto something that's separated from the road, and we're a big proponent of that. I think that will be something that will help safety and to save lives in the future. There's been a lot of study around the state. NCDOT has done some significant analysis on trail corridors around the state, and estimated that for every dollar you put into construction, you get back about $1.72 annually on local business revenue and sales tax revenue. So, a lot of findings. People are out there recreating and coming from all over to use different trails. And I think this particular trail is an opportunity for sure to be one of the special feature trails across the entire state. So I'll breeze through this a little bit. You know, if you guys have had some time to read through the document in all your spare time, it's there for you. I'd love for you to take a look. But I'll speed through this a little bit. And one of the things I would say is, you know, it's important for us just to get out there and see what's going on the ground, bring in our engineers and planners to take a look at that, and then having steering committee members out there with us marking up maps and working together. We know there's been a lot of planning to date, to John's point, so we wanted to make sure we brought that forward, everything y'all have been doing at the county level, and then with the city of Roxborough at that level too, in terms of recreation plans and comprehensive transportation plans that you all have been doing. And so those are the things we had to take into consideration for us really is, you know, on the natural environment, when we've got roadway crossings, how to make sure we do them safely, making sure that we're, you know, adapting to the surrounding land use and doing it in the right way. And so, you know, some of that ownership information we've obviously took a really close look at, and what was real important for us was to have minimal impact on private property. That's something that's really, really important for us. And so we were able to develop a number of different alternatives to consider, given different options that are in the landscape to get you from that southern part of Person County up to Timberlake and up into Roxborough, which is what we were charged to do. So yeah, so this is, you know, we broke it down into a number of different segments. You know, you'd be surprised at how expensive these things have become. And so it's likely going to be a phased process and something that we're going to have to look for external funding to produce. And by having an adopted study in place, it's going to help you check that box and be able to go after a lot of those grants that are out there today. And I think that's going to be something that's a key focus is finding those ways to get external funding to get the project built. So we developed it into multiple sections, as you can see here. I'm kind of breezing through with those number of different alternatives, but also the treatments that need to happen along the corridor to make sure it's done safely and to protect the natural and cultural resources along the way, but also to make sure we've got safe roadway crossings. So I think to your point, you know, the engagement was significant. We had dozens of people come out to workshop in Timberlake and Roxborough, and a lot of support for the project, largely support for the project for sure, a lot of interest in what it can do from a recreational standpoint. So a lot of excitement there, a lot of people marking up maps, drawing on boards, learning about the project, and so I think that was a good part of the process. And for us, it was very important that the public helped to guide this. So while we were looking at things like safety and user experience, we really wanted people to tell us what they wanted along this trail and what are the type of amenities they would like to have. You know, when you have a trail out there, you want to make sure it's an experience that people can enjoy. So what are those trailhead locations? What does it look like from a safety standpoint? How do you do maintenance along the trail? That sort of thing. So we ended up, you know, finally getting into the highest performing feasible alternative based on a number of different factors, cost effectiveness being probably one of the most important things for us, because we want to make sure we can get this thing built and we're not just talking about it for forever. And so the implementation strategy is something that, you know, we worked on next. And so, you know, that phase one would be that southern portion from the county up towards the southern part of Roxborough. And then still some more. You know, I think we worked really hard with the city, obviously getting a trail onto the ground through more of an urban landscape in uptown Roxborough. It's more of a challenge, so we had to snake that thing through, and we think that that's going to be something that would come next. But I think an important thing is to make that connection. Because in the long run, you're going to imagine people biking from Durham all the way to Roxborough and wanting that experience of being able to. I can say when people are biking, they're burning calories, they're looking to spend money at restaurants and getting drinks in Roxborough. So I think that's going to be an important thing to ultimately make that final connection. So yeah, zero is missing there at the end. It's shocking, right? 10 miles, you would $33 million is what we estimated. So this is going to require outside funding to happen. Part of the reason that number is high is just being conservative. Federal funds, particularly if they're used, they're usually additional dollars and cents that need to happen to make it happen. So that was what we was identified for that southern, almost 11-mile portion. And we looked at different types of roadway crossings that need to be done and done correctly for a safety standpoint. And then even some photo renderings of what it could look like. This is down at Helena Park in Timberlake, and you can imagine kind of just interacting with that landscape and what that could mean for that community. I think it's a nice way to visualize what the trail could look like. And then phase two being uptown Roxborough. A little bit of a lower price tag, but still not insignificant at all. And again, an opportunity to go out and get some outside funding and phase this thing. It's not gonna all happen at once. I think that's the important thing to communicate. And again, looking at different types of concepts of what this facility would look like, how to do it safely using some national NCDOT and MUTCD standards. Obviously, in some cases, we would look at some crossings and ways to access to the trail, how to do that. So we work very, very closely with NCDOT to come up with this concept. Very important that they're involved because they've got a couple of important roads coming through Person County, 501 being one of them that they maintain. So like I said, we developed implementation steps, and this is really, John said this has been discussed for 30 years. Unfortunately, this is going to continue to go on for a few more years. There's a lot of steps that need to happen to make this all happen, and making sure that we're continuing to leverage outside funds as much as possible. Certainly looking at private funding opportunities as well and leveraging. I think with trails, you can't just go and do it yourself. You've got to go bring in 3 or 4 or 5 partners and keep leveraging that money to make the best of your limited funds here at the county. So hopefully phase 1 would happen within the next 10 years. Securing that funding will be key. And I think with the administration in place now, it's really about rural economic development. And so I think there'll be a lot of different funding opportunities that may filter down through the state or through future grant opportunities. So I think, Person County remaining the lead agency, but working with key partners, NCDOT along the way. And we've identified all those different partners and the ways this all needs to happen going forward. I wish I could say we're done at the feasibility study, but really the next step is engineering and construction. And so this just paves a way to figure out what that's going to look like and how to get it done. So we have a number of different funding sources identified in our appendix. Some of these are going away. Some of these, RAISE, for example, is changing to build, back to build. That was the federal grant under Trump before, and now it's going back to build. So there'll be those opportunities that come forward. So I kind of sped through that, wanted to make sure we had time for questions, but again, wanted to just recognize the steering committee that you see there on the left of the slide. Just the participation was tremendous, the interest was tremendous, and appreciate the effort of the county on this and working with John, and excited about, personally what it can do for me. I bring my son up into this area sometimes just to get out into the countryside, and I think he's getting into bicycling, and we're on the American Tobacco Trail going down into Chatham and Wake County, and just amazing the amount of people you see down there using that trail. And he's always talking about, why can't this thing go all the way up to Roxborough? And I'm like, well, maybe it can one day. And so I think it's just something to keep in mind that, I think we're doing this for health and wellness, but doing it for economic development as well. So appreciate the opportunity to work on this with y'all. So happy to take any questions you have.
Well, first I want to say whoever did the feasibility study, I read through all of it and it was amazing.
Oh, thank you.
A lot of great information in there. Some of it, led to some other questions for me, but it was very comprehensive. So I was not captured in any of the photos, but I was at the meeting at the Kirby and at Timberlake. And then there was also another meeting that was a private meeting that was called by some of the major landowners out at Timberlake, and one of the industry representatives that would be impacted had a representative there from U.S. Blue Cured. So John was there, and I think it was Hart from DOT was there. And they had concerns about how it would impact the businesses out there, their private property, because you mentioned minimal impact on private property, and of course security.
Yeah.
So if it were reversed and it was starting in Roxborough, where we have really big connectivity issues, we've got sidewalks in places that don't connect to other places. We have people riding lawnmowers and wheelchairs down Madison Boulevard. Because it talked a lot about equity, and so obviously there's more people that would benefit from this beginning with the Roxborough phase. If it started there and was completed there before moving out to Timberlake, where that area is more rural, and where there were more concerns expressed, I won't have any more questions. But I think a lot of things have come up since 2023. Obviously, Person County and Durham County have just gone through a tax revow. There's a lot of questions in the community about where are our tax dollars going in both counties. I think Durham County did their, public meetings after Person County, and there was mostly opposition from what I saw on the news and read, about their sessions. So that brings a concern for me about, is that Durham section gonna actually happen? Because I think what people were excited about is what you mentioned, connecting to other areas. So my concern was starting in the south side would be the safety. On the steering committee, there were some great people, but I didn't see anybody from law enforcement or emergency services. And so again, if it started in Roxborough, I feel like that would be a lot more accessible and a lot less need to evaluate from a safety standpoint. I noticed on page 111, it said that $53 million price tag didn't include all costs, and that on page 150, there would be a position requested immediately, and there would be reoccurring funds, for that. And then I was curious as to whether the agreement that, Conservancy Group and Norfolk Southern ever actually came to an agreement, because back when we were having those meetings, they were saying that should be done in October, and I'm not aware if it has ever happened. I know Norfolk Southern had a lot of big changes, last year from the top down, laid off a lot of their workforce, and so I'm just curious if they still remain, a committed partner for the sale of the
Do you wanna,
easement.
Yeah.
I can address some of it, do you wanna do some of?
Yeah, do you want to address your part first? Or, I mean,
Go ahead.
so just to speak to the partnership with the, so we met a couple weeks ago. I believe Sally's on this steering committee as well, because GIS is very important, so we can figure out where things are. So we met with Durham, City of Durham, the Conservation Fund, and Person County, of course, to discuss that. And one of the questions I asked the Conservation Fund was, it okay to go ahead and present this, since it is just our feasibility study that gets us in position. And they said yes. They did convey that they have been working with Norfolk Southern. Norfolk Southern was amenable to going through a purchase process with the Conservation Fund. And then we were told that would probably take, they're in the shape file thing, portion of it right now, trying to figure out, land, deeds and land and all that jazz that lawyers and stuff do. And they said that they will probably be this fall before they actually have some type of an agreement between the Conservation Fund and Norfolk Southern. So that's where that pans out. It kind of keeps moving down the road, but that was the last we were reported. So one other question you had about the phase portion of it. So the main reason that the phase one took place, and correct me if I'm wrong, but one of the reasons that the study showed phase one was going to be in the southern portion of Person County was because that was the fully intact version of the railroad corridor, even though it has 2 breaks in that section of it. But that was the main driver to put that as phase one, because it was the fully intact version. Full list intact version. Phase two in Roxborough, that connection that goes from, I want to say Satterfield Drive or whatever, north, we had to break off into the utility right-of-ways. We had to look at highway right-of-ways. We had to look at all of that because that portion is not on the purchase table now, because that is still considered active rail. So that's kind of the difficulty in actually building this rail is what determined what those phases were going to be. And people have asked me plenty of times, if you had a choice of which section you would start on, I always ante up that I would start on the middle section, that is the north, that is north of the PCC purchase, or county's purchase for PCC, that building. I would start there and go all the way to Food Lion. That would be the first, I mean, if it does happen at all, that would be my first version, that connecting that in the middle so that you would have some kind of connectivity from that, that middle section all the way to the training center. It's the easiest catch that we saw. Everything else below that was kind of complicated, even though it is in the first phase. It's a little complicated because there was multiple bridges to consider, so on and so forth. Now, if it ever comes to fruition that the northern section from Satterfield North would come available, and the Conservation Fund would be able to acquire that, then of course your whole feasibility study would change. It would go off of those right of ways, and it would go on to either beside the railroad corridor or on the railroad corridor into uptown Roxborough, and that by far would have been our easiest, easiest construction, easiest act, whatever we had to do to make that sidewalk happen. So that's the explanation from why phase 1 and phase 2 are what they are. But like I said, southern Person County is going to be a harder development than the middle section of Person County. And then thirdly, I think Roxborough not having fully intact rail, or excuse me, not having an available rail north is the second hardest.
So, like I mentioned, U.S. Blue Cured was at that meeting, and they did not seem to want any kind of public passage through their property, which would be required. And you talked about different jumping on and off points, and maybe picking it up at the chat building, like you said, and going north, which I think would also be beneficial, more so than that southern section.
Yeah.
And again, I go back to thinking that people were excited about a vision that connected Person County to a lot of other places. And I just don't know if Durham is not committed because of their citizen pushback. We don't know that yet. We don't know if Southern's committed yet. And that northern portion that you're talking about, either the Roxborough part or that part, is where you would join 158, which goes into that state
Right.
trail plan that you talked about. And then, you mentioned one day connecting to American Tobacco Trail, but in the minutes it was saying ours is not really like that. Ours is like these different other trails. They had catchy names that I don't remember. So,
yeah, the whole grand scheme of the system is part of that initial, the initial Roxborough Rail Trail, which was from Durham, which was Durham County's version of their original trail study that was adopted by them, that ran 6 miles into Person County. And so I guess one of the reasons that we went into this study is so that to put us in position in case there was a purchase, which there is more than likely to be a purchase from from the Conservation Fund to Norfolk Southern. It's to put us in position to be ready to, I guess, take over that management of that particular railroad corridor. Durham, I do believe the city of Durham will have a big push to connect with this county of Durham. They have already set aside funding for the purchase of the railroad corridor in their particular jurisdictions. I don't know where Durham County is at this point, but I know that they did fund their feasibility study, and they are moving forward with their feasibility study, and that's where you see that initial pushback that you've been seeing on Facebook or whatever. But they're still very early into their study. I mean, they're probably a year out.
Yeah, I don't think I have much more to add. John really covered it well. Thank you for reading the document. I mean, it really is great because we have so many times that's not happening. So thank you for doing that for us and taking the time to do it. Yeah, I think that, I've been tracking, we're not working on the Durham one, we've been tracking it a little bit. But I think there are more people in support than in opposition, for sure. It's what's kind of coming out is what you're seeing some of the media reports. Having said that, this is all about respect for private property owners and what they've seen in their backyard or their farm for generations sometimes. And so I think that all these projects, when you go into design and next steps, require that sitting down. I did talk to Dave Proper at Conservation Fund, and that is all moving forward, so that purchase is gonna happen from Norfolk Southern. I think that, we've worked on projects like the Virginia Creeper Trail, which is a very similar type of landscape, a rural landscape. And I think sitting down and understanding what are the safety concerns, what are the liability concerns, what are the privacy concerns, there's vegetation, there's fencing, there's all sorts of things that can be discussed and worked on, but I think it requires that sit down with individual property owners to discuss it and not make it feel like it's some, entity coming out of nowhere, but it's this personal conversation and relationship that needs to happen. So that needs to happen over time. And, being a trail person, this is easy for me to say, but, we see it kind of time and time again that those who were concerned, once that trail is there, they end up becoming the biggest supporters. And there's just case after case across Virginia, North Carolina, and South Carolina where that's been the case. I will say that just because there is that history, but I think the concerns when you have bicyclists and pedestrians and families, it's actually, these are not people that litter, these are not people that are committing violent crimes, these are people who are really respectful of the landscape in general. But it requires that respect for private property owners and where they're at. And of course it would, like, all of a sudden you've enjoyed your peaceful landscape and you're concerned about people now being back there. So I think those conversations have to keep happening. This feasibility study, to John's point, is an opportunity to have an adopted study in place so that you can go out and get funding when you're ready for it. And maybe we phase that, like you said, maybe we phase that section you guys feel better about as phase one, right? And are able to sort of adjust that in a document so that folks can feel better about it. And then those discussions in the future could happen on future phases. So that's maybe a solution that might get at your concern.
Yeah, because there was, said in there that the trail area, was in the area of 5 of our top private sector employers. I couldn't think of what 5 that would be. It may have been before GKN closed. But I know one of them would be U.S. Flukyard, and they had concerns. So I saw that the Economic Development Director was on the steering committee, and I saw in the minutes where she offered to bring you all to a meeting with the EDC, but I'm not aware that meeting ever happened, or that they were ever allowed to, hear it and get advice on whether they thought it was good or bad for those industries, or if those industries were actually contacted. But I just want to make sure that we understand what we're signing on to. Is there going to be a position requested to go with this? And you mentioned taking on the maintenance. That's one of the first things when they buy it, is Person County taking on the maintenance. So surely that'll have a cost attached to it that's not going to be grant funded and will be ongoing.
Yeah, and so, like Matt said earlier, this is a conservative look. So in best case scenarios, yes, that we would ask for a position that would, down the road, if once the trail is done, we would ask for either part-time or a full-time position or whatever that would take to help to clean that trail and help to maintain it, watch out for it, so on and so forth. That doesn't necessarily have to be the case, depending on what the economic situation is with the county at that particular time, once the trail is built, or once a segment is built, because, maintenance could take place in-house, what we already take care of, just like in the park. We're gonna see what happens this first couple of years, and, not make a request and maintain it with our current, maintenance staff, cleaning and so on and so forth, putting it on our regular route. And then down the road, if we see that it needs that, then we would make a request. So that was just the best case scenario of if we could get all the bells and whistles.
Yeah.
I think the main focus for us right now is to know that we have an adopted feasibility study, so that down the road, whenever, if ever and whenever there is a purchase from Norfolk Southern by the Conservation Fund to Norfolk Southern, that y'all will be in position to say, hey, we have an adopted study. You're more than likely to get grant funding when we write grants to have an adopted study. But when, as Matt says, when it comes down to brass tacks and you start to move on a particular section, then that's a whole different study in itself. You know, the engineering, the dialogues between landowners, so on and so forth. And I'd like to talk about just drill down just real quick on the flute cured tobacco. So we do understand that there are portions like that, because that particular railroad runs right through their building, right? I mean, it's like so close right there. So I think once we get to that point, if we get to that point, then we would have to have that conversation with them and say, we know that this is the direction that this trail's going, is going right through, you know, your main segment of your property. Would it be feasible to, you know, change the route of what we do? I mean, the trail doesn't necessarily have to stay on the railroad corridor, and that's spelled out also in the northern section of Roxborough, you know, where we take on the utilities and so on and so forth. You know, if they would be admittable to going on the outskirts of their property, you know, 12 foot onto their property, or so on and so forth. We would have to have that type of wiggle room and have that type of negotiation with a lot of different landowners. But that wouldn't take place until we actually had dollars of funding, and then that wouldn't take place until y'all are ready to say, let's move forward with a section. You know, what section should we tackle? And, you know, Matt and his team could do whatever we need to do to change the wording on the phases to make that, you know, to make that in the feasibility study.
Actually, Sherry kind of hit on points that I had made note of, particularly the private property piece, and knowing people who live in the southern part of our county and right along the Person-Durham County line. That was their concern, which you talked about, and I appreciate that, about what they've been used to seeing for decades in farms and, you know, their property and their family. But again, you had some that supported and they were excited about it because times are changing. I appreciate that you hit on those points. And then the other piece when she talked about law enforcement and EMS, because that was the other concern that was brought to my attention. Both people who live like in Durham and Person County, right there in that little area where it kind of blends, was, you know, the safety piece of it. So she had already asked, so I'm not gonna ask that because y'all have already answered. So thank you.
Well, thank y'all seriously for taking on reading the document. That means a lot to us and for your county, representing your county, to take that all seriously. And, you know, I think one of the things too that I think would, you know, we've been part of those individual conversations, and I think respecting the landowners first and foremost. I think, you know, the other piece of it, I think from a big picture perspective for the county to consider when you think about existing industry, a trail like that would probably spur several more interested parties in developing out there. You know, you look at Research Triangle Park, they've committed to doing a lot of trails, and that's been a big reason why industry keeps moving in there, because they've got quality of life, right? They've got trails for their workers, and that attracts people from everywhere. So I think that's something to keep in mind. If you're playing the long game, a trail like this is going to generate business and industry and new interest. Your position very close to the heart of the triangle, I think, would attract a lot of those businesses and companies and industries to locate out here. So I think that's something to keep in mind too. That's what this trail would do. I feel pretty confident about that.
You know, I would say we also, talking about the development, me and Sally have already been working with the city and planning department and so on and so forth with the city, and already having conversations with developers. You know, there's one in town that we were having conversations with right off the bat to make sure that, you know, that this study and the trail is put into their applications, you know, their site plans and so on and so forth. So we have a number of admittable developers that would like to see that come through their particular developments.
And will oftentimes build the trail themselves in some cases because they know how much they can sell their lots for a lot more when they've got a trail like that their customers will be purchasing. So I think that's something to keep in mind too. and generate more revenue themselves.
Any other comments, questions? All right, what is the desire of the board? Do I have a motion to adopt the feasibility study?
Oh, yes, I moved.
Okay. All right. Any further discussion? All in favor, vote by saying aye. Aye. Any opposed? No. All right. Record stands 3-1.
Yes, sir.
Thank you. Thank you.
Thank you.
Thank you all.
All right. Item 8B, request for fund balance appropriations for the detention center, Sheriff Wilburn. Good morning.
Good morning. So I'm Mark Massey, Chief Deputy of Sheriff's Office. Was promoted to this position in November of 2024. I wish I was here under better circumstances, but I'm not. I'm using this opportunity to share information with you guys. And the main issue is additional funding for the Sheriff's Office to jail medical contract. Thank you for the opportunity to share this information, and I'd like to share with you guys the presentation, the challenges, and of medical costs and jail issues that we're having now that are multidimensional. Sheriff and I, we put together this presentation. Again, Sheriff Wilburn's here with me, and along with Captain Shelley, who's our jail administrator. I'll start off by saying, in North Carolina, the law governing inmate medical care in the detention centers and jails is designed to ensure that inmates receive adequate medical treatment while in custody. There are several regulations and guidelines that both state and federal authorities set forth to provide health care to incarcerated individuals. Number one, the constitutional rights and legal precedents. The Eighth Amendment under the U.S. Constitution, the Eighth Amendment prohibits cruel and unusual punishment. This has been interpreted by the courts to mean that jails and prisons must provide adequate medical care to inmates. Failing to provide necessary medical care can lead to lawsuits based on constitutional violations. The North Carolina state constitution, while the state constitution does not specifically address medical care, the legal requirement for humane conditions and treatment is implied under both state and federal law. Healthcare standards. North Carolina jail standards. The North Carolina Sheriff's Standards Division, which is part of the North Carolina Department of Justice, sets forth requirements for health services in county jails. These standards are designed to ensure inmates receive adequate medical attention, including the provision of mental health services, dental care, and emergency medical treatment. The county detention centers. County detention centers are required to provide medical care to inmates, including routine medical services, access to emergency care, and treatment for chronic conditions. They may contract with outside healthcare providers or hire in-house medical staff, such as nurses and physicians. Upon intake, inmates should undergo a medical screening to identify any immediate medical needs, including substance abuse withdrawal, chronic medical conditions, or infectious diseases. This helps detention centers ensure the health and safety of inmates and prevent the spread of diseases within the facility. Inmates are entitled to access health care services when needed. If an inmate requires medical attention, they should be able to request care and receive a timely response. This includes both emergency medical treatment and ongoing care for chronic conditions such as diabetes, heart disease, or any mental health conditions. Mental health care is a critical part of inmate health services in North Carolina jails. Jails are required to provide mental health screenings, and inmates with mental health needs must have access to appropriate care. This includes access to counseling, psychiatric services, and of course medications if necessary. There's a couple of federal guidelines and laws also. In addition to medical care, PREA, which is guidelines, also require detention facilities to provide care for inmates who have been victims of sexual assault while incarcerated. This includes providing access to immediate medical attention, as well as counseling and treatment for victims of sexual violence. Americans with Disabilities Act. Jails and detention centers must also ensure that inmates with disabilities receive the necessary medical care and mental health services under the American with Disabilities Act. The legal recourse for inmates. Inmates who believe they have been denied adequate medical care can file grievances within the detention facility. If their complaints are not resolved, they might file a lawsuit under 42 U.S. Code 1983, claiming violation of their constitutional rights to medical care. If an inmate is harmed due to the failure of the facility to provide care, the jail or detention center may face legal liability for damages. In some cases, local health departments and North Carolina Department of Health and Human Services may be involved in overseeing the provisions of medical care in detention centers to ensure compliance with state laws and standards. And then what we're seeing mostly, substance abuse and detoxification services. Detention centers must also provide necessary medical services for inmates who may be undergoing withdrawal from drugs or alcohol, ensuring proper care during this detoxification process to prevent other serious health complications. North Carolina law, in line with federal guidelines, mandates that detention centers provide that access to medical care for inmates addressing both physical and mental health needs. And one of the sheriff's obligations is to fulfill these needs. So, overview of medical costs. Sheriff's Office, our jail budget, which is 1004320 line, or 419200 for professional medical services for inmate medical costs, in the 24-25 budget was set forth at $352,420. The annual medical provider contract cost totals about $207,767.40 a year, that being $17,313.95 per month. It's paid monthly. This fiscal year, we were already behind amount of $130,887.88 starting July 1 when that budget got approved due to previous year's contract shortfall. That was a little rundown about the initial numbers. Now the actual medical cost. At Person County Detention Center, we house inmates brought in for charges from the Roxborough Police Department, North Carolina Probation and Parole, ALE, Highway Patrol, Wildlife, and of course ourselves, these being pretrial. Once the inmate is given a release order, they become the responsibility of the sheriff and sheriff's office, including medical care. Inmates held serving sentences, medical care is provided by the state. So once they're adjudicated through the court system, then they become on the state's dime per se, and not ours. Prior to that trial, it's totally under the sheriff, falls under the sheriff's office's responsibility. This is for the past couple of years. If you see, our budget for 2021 was $334,062. That stayed consistent, give or take. During that 21 year, we had a shortfall. We spent $440,414.11. 22, $334,062. We spent $444,563.49. In 23, this was a big one, and we'll get to that, but $338,062. We spent $828,293.94. In 24, $338,060, and we've spent $526,046.15. Again, this is all medical costs per se on that line out of the jail budget. And then, of course, this year, $352,422, and the cost is ongoing. And I have some numbers or averages also to carry us out. Again, the shortfall, and I guess I can come back to this next slide. So I will have a little bit of good news going forward, but it's extremely difficult to project future costs along with costs of numbers of variables. However, we have a new policy implementation that the sheriff has implemented, and projecting numbers, the cost savings will be over $1.5 million over the course of the next 5 years. That's the good news out of all of this. I know I sit here requesting more funds for this year. I just wanted to give you insight down the road. Our problems over the past few years that you saw, the reasons for the budget shortfalls, several inmates have incurred extraordinary medical costs in recent years. I have an example. One inmate alone that we housed pre-trial on 2 separate occasions. And what I mean by 2 separate occasions, he was charged, brought into our jail for a stint of time, released for whatever reason, whether they gave him credit for time served, and within a year and a half, he was right back in our facility again. This person was deemed to have mental health issues, but himself alone, and some of these bills that we're talking about include him. But one inmate alone had medical bills amounting to $296,862.83.
And that's just this fiscal year.
That's this fiscal year. That's just one inmate. And on an average, we have about 97 to 100 inmates daily. So you can see how taxing, if our budget's $354,000, how one inmate with severe mental health issues or medical issues, or both in this case, can be a cost to the county. The reasons for some of those high costs, again, inmates requiring long-term care, complex surgeries, mental health treatment, or emergency medical services. We recently had one just as recent as last week that was in and out, didn't show up for court, had issues. I looked up Friday, had several bills a couple years back that we spent quite a bit of money on, and he was incarcerated again pre-trial recently, went through alcohol withdrawals, and was looking to be in long-term care once he's in our facility. So obviously, once he gets there, not having access to the alcohol that his body requires created a lot of medical issues for him. We utilize Southern Health Partners as our, not necessarily a medical provider, but an intermediary. They do contract. We do contract with them for our nurse who's down there. So the remaining medical bills that we owe to them now, after exhaustion, is $595, $765, $93. They manage those bills. They receive the bills after a company named Prime Health Services. They kind of scrub the bills. They scrub those top-end costs, those high-end costs for them, and then they send them to Southern Health Partners, in which we receive the bill, and it shows the adjusted rates. And then the contract costs left out for the remaining of this year, they out of that line we have paid up until February of this year. So we'll need $86,569.75 to finish out that contract cost with them that provides the nurse. These bills and contract costs are critical to address the avoided disruption in inmate health care services and to meet contractual obligations. And then you see there the total fund needs that we have to get caught up for past medical bills and these upcoming contract payments. And it does not include any future medical or safekeeping bills. These are just estimated bills that needed to finish out the remainder of this 24-25 budget. The future for safekeeping, $11,335.49 estimated, based on a monthly average of what we spent thus far with Southern Health Partners, is about $312,223.98. As recent as Friday, I was able to get a hold of Southern Health Partners, and I think the March bill, which we haven't officially received yet, is looking just right now is $60,000. The medical needs in the inmate population, the growing number of inmates with mental health issues and drug dependency. We have seen this skyrocket over the past several years. More medical treatments required for inmates suffering from chronic conditions and substance abuse related health concerns. I would say that's probably our biggest contributing factor that has created the larger cost in healthcare. We're seeing that more and more. The length of time that pretrial detainees remain in custody is increasing. I think the courts are going through new processes to get those pretrial detainees be seen before judges and get their sentences started. But again, it's another factor that's driving up those costs. And the longer they stay in our custody, obviously, the higher the medical costs for those individuals. This is relative in a way that I wanted to show. In 22-23, we had 87 calls of EMS being called to the law enforcement center for whatever medical needs that may arise there. In 2023 to 24, we had 91 calls. And to date, from 24, and when I say 24, I mean in July of last year, to date, we've already had 71 calls to the law enforcement center. And again, I thought this slide was important just to show the trend that we're seeing. The analysis of this budget shortfall with the existing $17,313.95, our monthly contract with that Southern Health Partners, and the post-contract medical costs from June of 24, along with the exorbitant required medical bills monthly, the allocated funds were already exceeded in the first month of 24-25. We blew right through those as soon as we got those first bills in. Ongoing increase in medical expenses due to long-term stays and complex health issues. Certain inmates and conditions that they have when they come into the facility, they obviously aggravate the cost also. And then the impact of the shortfall. If the shortfall is not addressed, then there's a risk of compromising the inmate's health care provider and medical contract obligations. The additional funding is critical for increasing population of inmates with complex medical needs, the legal and moral responsibility to provide adequate care, medical care for inmates. Failure to address the funding gap result in compromised inmate health care and potential legal consequences. And the trend toward longer pretrial detentions means more inmates requiring medical treatment for those long periods of time. A little bit of good news, if there is any, is in August of 2024, we researched and came up with I didn't come up with it, but we implemented a new policy to address these high medical costs. Again, it's been implemented in August 24. We're not seeing the fruits of that labor quite yet, but all incoming inmates are now enrolled in insurance through the Affordable Health Care Act. The company that handles this, handles it for us, but who we go through and submit the documents is Health Plan Freedom. And the Sheriff's Office works with this independent company to verify insurance eligibility and enroll inmates. And that's done on the intake process now. We discovered this during the summer of 24 and acted aggressively once we got everything lined up with that group, had meetings with them, and thought that this was going to be a good idea for Person County and for the Sheriff's Office. So that's when we started it. The inmates are issued now insurance cards, which are stored on a shared drive. The medical providers are given these cards to cover medical expenses. And what that means, if inmate requires medical treatment, whether it be a routine appointment or they have heart issues when they come in, now when they go to the medical provider, they actually have their own card that our jail staff or transport officers ensure that provider gets on this person. Now, not every inmate qualifies, which is what Health Plan Freedom comes in. Obviously, we wouldn't know who has insurance or doesn't. So they do, that's what they do, is when the information is submitted, based on income, based on different situations, they look through their file, see if there's someone current that does have current insurance, along with if they are available for, eligible for the Affordable Health Care Act, then they enroll them. And what we're seeing now is mainly here in our area, the inmates are receiving insurance through Blue Cross Blue Shield. There are a few exceptions where the inmate just won't qualify for that insurance, but the representative from Health Plan Freedom relays that it's about 98% of our inmates will qualify. So the max, just like our insurance, these inmates will have a max out-of-pocket cost. So the county is responsible for those costs not covered by insurance while the inmate is in custody. And what that means is that crazy number that I showed you earlier with that one inmate, if hypothetically he was eligible to be covered under insurance, the possibility of that $396,000 would now be $4,000. Again, I don't know without submitting his form if he is eligible, but that's just a good situation to look at if so. The impact so far by this implementation, we're not seeing it a whole lot right now due to the fact there's a lapse in billing, the times we get the bills. So, for instance, when we get the March bill, it may be for events, medical events that happened 1.5 years, 2 years ago, prior to us implementing. So there's a window there that we're waiting to see what type of positive impact it has on our budget. We are seeing a decrease in the length of stays. So, for instance, Captain Chandler's detention officers, they carry an inmate, claiming that they're having seizures, and they have to be taken to Personal Memorial. Well, they go out. Captain Chandler provides the Personal Memorial with that insurance card. We're seeing the length of stays are a whole lot shorter now. So not only is the cost for that's going to go down, but it's also a lot less taxing on the staff having to stay with these inmates for 2-3 days, 24/7 over the course of time. And the future projections, once the billing cycles are caught up, and the sheriff and I spoke, and we're hoping 3 to 6 months, 6 months for sure, we should start seeing a better trend. But we anticipate the significant cost savings, and we'll report on those savings at that time. Now, I guess the meat and potatoes of this. The total funds needed to get caught up on today's date, March of 2025, is the medical bills owed to Southern Health Partners from October 24 to 25, which is that $595,765.93, and then $86,569.75 is the remaining monthly contract to Southern Health Partners, which is February of 25 to June of 25, and that totals $682,000, $335.68. Excuse me. And again, that gets us caught up to date. I already previously explained how we already know that the March is around $60,000 range. And then obviously our recommendation and our request is the funds needed to complete the fiscal year 2024 to 25 to cover projected costs for future safekeeping, medical expenses, and the remaining Southern Health Partners contract. This is not addition to that cost above, but it's a whole separate figure with the overage to be returned to county funding if not utilized. Again, I did the math with the average of what we're averaging monthly, and that's how I came up with that 312. If you see those same numbers at the bottom, the $595, $765, and 93 cents owed to Southern Health Partners, the $86,569.75 Southern Health Partners contract, the estimated monthly average of safekeeping $11,335.49, and then estimated future Southern Health Partners medical bills if they stay on the same trend and we don't see any benefits throughout the rest of this remaining budget year is $223.98, and then currently remaining in that fund is $10,037.19, and that's in that line for professional medical services. So the total to finish out this year request is $995, $857, and 96 cents. Meeting this funding request ensures continued medical care for all the inmates and compliance with state and federal regulations. Again, I know the sheriff and I, we talk about it daily. This is, we wish that this money could be used for something else, but we're just obligated to take care of these inmates. The conclusion, next steps. The sheriff's office is committed to ensuring the health and safety of all the inmates. We need the county board's support to allocate the additional funds needed to complete this 24-25 year to cover projected costs through June 30th of 2025. And want you guys to know that any remaining funds not utilizing this line due to over-projecting will be returned to county funds. And to understand, the sheriff's office is doing due diligence with county funds and are currently and have been aggressively seeking various methods and policies to find cost savings in every area as seen in the implemented policy of the Health Plan Freedom. Thank you guys. Any questions that you guys might have?
Could you back up real quick?
Yes, sir. Do you
Go back
remember
to
which
the,
one?
projections for the next 5 years.
That's right ahead.
There. with the implementation of, getting the inmates on intake signed up on the, Affordable Health Care Act, and speaking with the company that we're working with, and the cost savings that he has seen across the other sheriffs in the state, which I think they have 32 counties, there's only 32 counties in the state who opted and get insurance for the inmates. He's seeing hundreds of thousands in significant savings. And just looking at the numbers that he told us, and looking going forward, we're looking at the last 5 years and counting this year and what is projected for us to have to pay in inmate medical care. Taking those last 5 years in total sum and going forward over the next 5 years, I feel pretty confident with a very conservative number of saving about 1.5 million in cost of inmate medical care, having them signed up on insurance, private insurance. Because like he said, you know, we're not seeing those numbers coming down because the bills that we're receiving now, the dates of service, some of them have went back to 2022. You know, it's just those companies take so long to process those scrubbing of those bills with Prime Health, which we're no longer with Prime Health. We ended that contract with them because it was just delaying the whole system.
And plus too, they were taking a cut, Prime was taking part, they charged us the fee to scrub the bills, so now we use Southern Health Partners, which don't charge a fee to scrub the bills.
For the contract. Yep. So with that going forward, like you said, that's the only bit of, you know, good news that we see in this, but, you know, that just started a couple of years ago, and we was able to find out about it and implement that process in August of '24. So again, you know, you got certain inmates that just require so much, you know, maybe you talked about, you know, mental health and how it's, I hear that across the state from all the sheriffs when I'm at conferences and about how their facilities have turned into mental health institutions because of the shutdown of John Olmsted and Dorothy Diggs type hospitals. You know, they leave them in the sheriff's custody, you know, for whatever reasons. And we said it time and time again, and the captain can say as well, we have a lot of inmates that we're housing that doesn't need to be in jail, in my opinion. They got mental health issue, but, you know.
Well, I would like to share that, while I was on Capitol Hill, a couple of weeks ago, that was one of the things I talked to our congressman about, is how we can reduce medical costs in our jails. And it's not just in North Carolina. That's why I was over here where y'all were talking, because I attended one of the workshops and sessions because it's happening across the nation. And it was saying how pretty much the counties, what you've already talked about, how we're required to provide this service, and how much money is spent, and what they're looking at is trying to have Medicaid for those, because once they're arrested, they're in jail, like all of their benefits stop that they would normally have, so that cost is on the county. And with you all, you know, I appreciate you all going through the Affordable Care Act to try to help alleviate those costs, but then even if we're able to get that passed where Medicaid can still be in place for those who qualify for it, that would be no cost while you're housing them. And again, the majority of the folk, what we had talked about, and I was sitting here like just underlining, some things is behavioral health, is mental health, and they shouldn't be there, but we know that there's nowhere else. So they end up in our jails, and we know that our staff in our jails, they are trained to deal with criminal justice, not mental health. And that puts a liability in so many areas. So, it's not just in North Carolina. I just wanted to make that point that it's across the nation. And
Speaking on Medicaid, somebody who's covered with Medicaid and they are arrested, Medicaid stops once they're incarcerated. And then it's up to them to re-enroll in Medicaid once they are released. A lot of people don't, and that's what they're seeing.
Yeah.
And you said it's across the state. We did speak with Brunswick County Sheriff's Office, whose inmate medical care budget is in the millions, and they just went before that board requesting over $1.5 million.
Yeah, it's everywhere. But so the push is what we talked about was getting Medicaid, finding a way even when they're housed, because once they're convicted and they're sentenced, the state takes on that medical cost. But until then, it's the county who is responsible for that. And we're looking to see, trying to push for Medicaid to remain while they're, until they're sentenced. So that cost wouldn't be a burden on the counties, but it's happening across the nation.
So I guess, in a way, that's good to hear, because maybe it means, we'll get some relief from outside of the county. And also, I'm glad that y'all have implemented, the insurance, but I'm sure, like you said, there could still be other stuff lurking out there. So my questions are from the standpoint of us having to be able to budget and prepare for these things as best as we can, and not have these kind of surprises in the year. I mean, I guess one thing is I spent 6 hours going through the packet this weekend, and this was the only item that was submitted that was a request for funding that didn't have a price attached to it and any supporting documentation, so we didn't receive anything ahead of time of what this would be. So I don't know if that's because, like you said, you were still finding out as of yesterday or as of Friday what some costs would be.
So I think I provided the initial spreadsheets, last week, the initial spreadsheets on the actual cost needed, minus the PowerPoint last week, correct?
So that wasn't enough.
That was not, because it was a spreadsheet with numbers, so we had some conversation around needing to have the context to go along with it in the agenda packet, so I was reluctant to put a number in, on the agenda abstract without having supporting information to go along with that as far as the why and the, what actually was contributing to that number and what was needed. So that's why a number was not included in the agenda packet, because we did not have that information. The spreadsheet, I think, was on Tuesday, and the PowerPoint was finalized later in the week, because they were still working to get some of those details.
And so going back to the slide about the past medical bill history for the last 5 years, and it looks like it's always over, so why not? I mean, it looks like $450 would have taken care of it for a couple of those years. If you're seeing it always trends more, then why not ask for more in the budget, during the budget process to?
We did initial requests every year. I've always requested more. It just gets trimmed down to that number there. We ask for it, but it just gets trimmed out of the budget because I guess of the unknown, not knowing what the medical cost is gonna be, and, but yeah, even, I think I requested $450 the last 2 years, and it just got trimmed from that down to what was the recommended budget and what was approved.
So every budget year, you have to come back during the budget cycle and ask for more?
This is the first time we've ever presented to the board about any of the reasons why and funding why. It was always added back to our budget. That was just like it's on a consent agenda. I don't know. Appropriation of funds.
Yes, in previous years, because it has not amounted to the amount that we have currently, it's been, in some cases, the budget has been amended by, in the past 2 years, $150 one year, $220 another year. We've been able to recognize some additional property taxes, at least in one of those instances. I haven't researched every time, and it's just been handled through a budget amendment. But because of the magnitude of the overage this year, which is attributed to some of these bills coming in, as they said, a couple of years after the fact, then we did not have the flexibility to be able to do that with this overage. So there is a need to make a fund balance appropriation to cover this overage. So similarly to
And
how.
one year, I think in '23, when it was about 500,000 short from what was requested and what was budgeted, I think that a large bill came in towards the end of that fiscal year, if I remember correctly.
So
In
that
that
year, it was $828. This year, it's $995 that we know of. So the $828 was under the threshold, but the $995 is over?
In looking, there were about $400,000 of bills that came in after the end of the fiscal year that year that were related back to bills for earlier in the fiscal year. So in that case, since we had already finished out the fiscal year, the function was able to absorb that overage. There was funding available within the public safety function from lab salary or other expenditures that were not used with the budgeted funds to cover those additional bills. So there was a budget amendment. There were transfers in during the fiscal year of $153,000 in that fiscal year. But that line in Munis actually shows an overage of $335,000 because it was covered within the function after the fiscal year had ended from available funding.
So all of this has to come from fund balance this year, this time?
That's what we are recommending, from having evaluated anything that is available within the function. It's very close, and we would recommend going with how they had presented an option 1 and an option 2. The option 2 to go ahead and appropriate approximately $1 million in fund balance to ensure that we have enough funding available within the public safety function. We budget on a function basis and need to ensure that we have enough, so we won't have an audit finding at the end of the fiscal year with it available within that function. But it would be for this specific purpose. And if our jail medical expenses do not come in between now and the end of the fiscal year in that amount, then that would revert back to fund balance at the end of the fiscal year if it's not needed for fiscal year 25.
Well, I mean, no more is coming, so I don't see the point in just approving option 1 when it's not even going
Right.
to meet the contractual
Right.
needs for the rest of the year.
You know, it's just, our inmate medical line, and then our payment to other governments is something that is so hard to project because of the juvenile age reduction went from 16 to 18, the juveniles. And so now, let's just take, for instance, a 16 or 17-year-old gets incarcerated, we can't house them. So we have to pay another entity to house them. And, you know, that was one thing that happened a few years ago. That was just, we had 10 juveniles that was incarcerated throughout the state. And we had to pay that bill, and there was no way to, you know, you never know when you're gonna have a 17-year-old incarcerated.
Another important piece of information that I guess either went through it too quickly or left out is if we have an inmate that we feel that we can't physically take care of, he has such issues or mental health issues, right, that it's unsafe for him and our staff to be in our facility, they do attempt to get him into safekeeping. Well, that's okay. He goes somewhere else, but that doesn't change the obligation of the payment. We're still responsible for those payments. So he may be unfit and more than what we can technically handle in our facility, but again, we still pay for him in safekeeping, which is what you see. A lot of these high numbers are, and I just went through those billings and the spreadsheet that I sent over to the county last week. Obviously, with HIPAA and things like that, I had to remove names and come up with, you know, a different way to identify them. I thought it was important, if y'all end up with the spreadsheet, to see that each letter represents a person. And you'll see on there that there's a handful of persons or letters in this circumstance that are numerous times throughout. And that's where I came up with the number, the one gentleman who amounted to $300,000 in bills. There's another one, and I just pulled up some instances where a couple of letters went just 1 or 2 times, $14,000 for one inmate. Another one was $10,000. Another one was $28,000, $15,000. I mean, the trend that goes on, that once the inmate leaves and goes to the provider, those numbers are, you know, high, so high that, I mean, the 350 is definitely not going to cover it. So, again, as the sheriff stated, we're hoping that this new policy that we implemented last August starts to show, and our trends are trending down somewhat. I called Southern Health Partners Friday to get the most recent updates, so I'd have the most recent information for you guys. And some of those costs, as far as looking at the trends, the numbers is starting to go down once those people that have insurance is being applied. So, thank y'all for your time.
I assume that your budget request is what you've got projected here, the 400,000 going forward, in the coming year.
Yeah.
It's actually 450,000 is what the request is currently.
Okay.
All right, any other questions? What is the desire of the board?
Move to approve option 2.
Okay, we have a motion to approve option 2. Any further discussion? Having heard none, all in favor, vote by saying aye. Aye. Any opposed? The ayes have it, the motion's approved. Thank you. Next, we have strategic plan quarterly report and fiscal year 26 update, county manager.
Good morning, everybody. Included in your packets is the quarterly report for the strategic plan for the progress that was made in the second quarter of this fiscal year. So it was October, November, December of 2024. And that is broken down by department. It does include comments for each quarter. And it also correlates back to the goals and objectives within the strategic plan, as well as the budget objectives that are established at the beginning of the fiscal year, and includes some new initiatives that have been implemented during the course of the fiscal year. So a few of the highlights as far as specific objectives that have been completed in the second quarter. Many are still in progress. Many of these objectives are works in progress throughout the fiscal year and from one fiscal year to the next. But some of the accomplishments that I would like to highlight is that in the second quarter, we did purchase both the Human Services Building to house DSS, Health, Freedom House, and Juvenile Justice, as well as the Chat Building for Piedmont Community College. So both properties were closed on in October. In addition, we completed the runway strengthening project at the airport. We submitted the fiscal year 24 audit prior to the deadline. GIS worked with the city of Roxborough to complete their lead and copper survey. And DSS hired 2 staff development specialists and began internal training for Medicaid staff within the department. So there's just a few of the things that I wanted to highlight. And I hope you've had the opportunity to read through the progress report, and I'll be glad to answer any questions that you have about that portion. And then I did also want to have some discussion around the strategic plan as we look at any updates we want to make to that in advance of the next budget year. So first, if you have any questions about the progress report, I'll be glad to answer those.
I really appreciate this, and especially the departments that put in more detail with statistics and whatnot. EMS did a really good job of being very specific about what they had accomplished, and there were some other ones too. I did have a question on page 239 under administration. It looks like there's still $654,000 that is available to the city for Western Sewer that they have not utilized.
Think so. Tracy has stepped out for a minute. I believe that's still the case. I can look it up in Munis and see.
Well, I mean, you don't have to
Yes,
verify right now.
it
I'm
is.
Okay, so I know they got a lot of money, grant money for that project, so I would just, can we check with them and see if
Sure.
they feel like they're gonna need that money, and maybe we can allocate that to something else if not?
Yes, I will check with them.
And then, what was the current status of 2.2? I don't know if there's any updates since December about evaluating the water and sewer needs outside of the city limits, or?
No, we have not worked on that.
And, from page 241, how much money is in that opioid settlement fund?
I'll have to get back to you on the exact amount. It is accumulating year to year, and we've currently approved 2 projects, and there's another one pending with the committee that would then come to the commissioners for y'all to consider allocating the funding. But I can get a report for you as far as what we've received so far and what we anticipate receiving.
Okay. Yeah, I would be interested to know.
Okay.
What the details around that fund, what it can be used for.
Also, at the bottom of 239, you have, in regards to next step, enter into agreement with PCC for the use of the chat building. I thought we've already entered into, that's been completed.
It has been, so it was completed, I think in January, so it was not completed,
Okay.
prior to the end of that quarter.
Okay.
And, just a question about, on page 241, was the volunteer training ever done? I know that a handbook was
Right, we did the
shared.
liaison training, but we have not done the volunteer training yet, so
Okay, I
that's
did
still
have
to
some
do.
people comment to me that were appointed to boards that they didn't receive any kind of orientation or anything from, staff, or, you know, they
Right.
just kind of had to come on and figure out how to get up to speed
Yeah.
where some things were, so.
Generally, it's been done board by board, so we have put together an outline for a volunteer training, but have not conducted that yet.
Okay, that's all I had, thank you.
Okay?
Any other feedback for the county manager and staff? All right,
Okay.
Thank you for the update.
And then as just the next piece of the agenda item is to consider potential updates to the strategic plan as we're working through this current budget process, and then you may adopt any changes at a future meeting. But during the budget retreat, Commissioner Wilborn had made a few suggestions as far as modifying the mission statement and some of those core values that are listed on at the beginning of the strategic plan. So under the mission statement, it currently reads to provide effective government services that enhance the quality of life for individuals and businesses in Person County by preserving local history and resources, facilitating economic growth, and supporting lifelong learning. And the suggested change is to update the word facilitating economic growth to catalyzing economic growth. And then when you look at the values, there is wording within the community value that Commissioner Wilburn had suggested some alternative wording for that, as well as transparency. The final statement there is communication is a priority, and the suggested wording is adhering to open government policies and statutes is a priority. And then for the opportunity, again, changing facilitate to catalyze when it comes to economic growth. So just wanted to find out if anyone had any feedback on those suggested changes.
I had one, and I'm over here moving around because my agenda and everything is shut down and I can't get it back up
Yeah,
or
mine too.
anything. So I can't follow along. But I think it was one where community friendly. I was thinking about community centered. I can't remember which one.
So with community, it currently says, we are welcoming, inclusive, and accessible. We are family friendly, celebrate our traditions, and foster strong community spirit. We prioritize public safety and personal well-being. And the suggested rewording is, we are family friendly, celebrate our agricultural and industrial heritage, and prioritize public safety and a strong quality of life.
Okay. All right. That's fine. Now that I hear it again, it's fine. I was thinking change of friendly to centered, but that's fine. Yeah. I'm good.
And then, any other feedback on the values and the mission statement? Moving into the economic opportunity and growth focus area, some rewording suggests, well, first, the addition of 1.4, which would be to promote the county's assets locally, regionally, and nationally through online and social and print media platforms and in-person marketing and recruitment. Is there general support for that one, or any thoughts?
Fine with that.
And then for 2.2, rewording that, it currently states, evaluate needs for water and sewer expansion outside the city limits, and reword that to evaluate water and sewer capacity and city-county needs for future growth, revisit interlocal agreement. So that's a little more specific in terms of steps to take. And then add 2.5, which is evaluate transportation and rail capacity and needs for current and future growth. Okay, and then within the focus area of service excellence, Commissioner Wilburn had suggested removing the goal, which was 12.2, conduct a community survey. So we had originally proposed that as a way, what that would likely involve would be to contract with a firm that would conduct the community survey on our behalf. It would be something that would be, grounded in research, and we would be looking for a particular response rate. It would be marketed, so we could learn more about the community's view of the services offered by county government, as well as the needs within the community. And of course, there's an expense tied to that, and just want to find out whether or not that's a priority for the board to do over the next year or two. We don't currently have funding for that in the budget.
So, has that been done? I know we do that for like certain interests, for certain projects, but have we ever had just an overall
Not to,
community survey?
not to my knowledge. So that would be a new initiative.
Okay.
My reason for removing it was just because, I didn't realize it was a third party kind of thing, but still that's additional cost. I was thinking it would be something that staff would have to take on, and traditionally, you get three or 400 responses, which is not an, depiction of the whole community, and, like you said, it's not in the budget, so.
Agree.
That one, I guess we'll just have to look at the cost for that, because I know with certain initiatives and certain projects, when ads that we did, like a community survey or studies, and then you have communities coming up saying that, well, I didn't hear about it, I didn't know about it, no one talked to me about it, how do I access that? So just trying to find a way, even if we take that out as a county and as county leadership, to make sure when we do things that everyone has like access to be able to have their voice heard so that it can help us make sound decisions for everybody.
Mm-hmm.
So I don't know how we could do that, but
It's always a challenge, get people to engage when
Right.
you want them to in a helpful way.
Right. Okay. Well, those were some of the changes to consider, and if y'all have any other feedback related to the strategic plan and how that ties into the budget process, just let me know. We can have another conversation about this as we move forward. Thanks.
I'm sorry, I had to step out for a moment, but I can answer Commissioner Wilson's
Okay.
questions that you prefer.
About,
Regarding this,
Opioid and water supply.
okay.
Okay, so if you would not mind restating your questions, just so I know that I'm answering exactly what you wanted.
Well, I think Catherine answered the one about the western sewer, that the
Okay.
city has not requested that $654,000 that remains.
No, they requested one-time payment last fiscal year. I did speak to the finance director there, and the reason being is they have other funding, and they believe that it would be double dipping to request the funds from us while they have state funds.
Okay, so does that mean they release those funds?
They have not, we discussed that. Janelle was gonna take that back to her manager, and that is where it's at right now.
Okay. And then I was just asking how much is in the opioid settlement fund?
We have budgeted a little over $2 million to receive. Currently, we have received $1,416,700.
So there's a total of 3.4 million?
No, we're supposed to receive a little over 2 million. We have this coming in over years times. What we have actually received is 1.4 million.
And what's there right now that's available is what?
That is available there right now. Very little of it's been used. We have $150,000 that is budgeted for school nurse initiative in this fiscal year, and we have other funds that are budgeted for EMS, but they have not been used yet.
Okay. So maybe at a future meeting, if we can, see what they could be used for, if there's anything that could be used for the
Janet
current budget requests.
Clayton is the person who is in charge of the opioid funds, and she's on that board, and she would be a great asset to ask what we're allowed to use those funds for. It's very restricted.
Okay.
Yeah, she's actually attending the NCACC opioid settlement, or summit this week. And my understanding is that the committee has considered another funding request, so I anticipate that she will be coming back to the commissioners soon with information around that. particular request and the recommendation from the opioid settlement committee, and can also provide some additional updates in terms of just overall funding, what we expect to receive in the future, and how the funds can be used.
Any other comments? All right, thank you. All right, next item, appointments to boards and committees. Madam Clerk.
Yes, sir. Thank you, Chairman and Commissioners. I'd like to present boards and committees to you today. So we do have a few applications that I would like appointed as you deem appropriate. The first board would be the Board of Adjustment. There's 2 positions available, and also a third position for an alternate. We had the following application received: David White. May I please ask the desire of the board?
Move for approval.
All right, motion to approve David White. Any further discussion? All in favor, vote by saying aye. Aye. Any opposed? The ayes have it. Motion's approved.
Thank you. The next one is for the Local Emergency Planning Committee. There's 1 position available for a local environmental group. Sammy Clayton, request appointment. May I please ask the desire of the board?
I know he is on the EIAC.
Yes, ma'am.
I move to approve.
All right. Motion for approval, Sammy Clayton. All in favor, vote by saying aye. Aye. Any opposed? The ayes have it. Motion's approved.
The next one is for the Opioid Settlement Advisory Committee. We have 1 position for a citizen at large. This position could be for lived experience or for a person that has a family member with lived experience. We have 1 person apply, Brandy Newman, request appointment. May I please ask the desire of the board?
Move for approval.
All right, motion to approve Brandy Newman. Any further discussion? All in favor, vote by saying aye. Aye. Any opposed? The ayes have it. The motion's approved.
Thank you. The next one I have is the Workforce Development Board. There's 1 position available for the following: a business and industry representative, Mr. Charles Derek Sims, request appointment. May I please ask the desire of the board?
I'm gonna have to think on this one.
Well, I saw a letter in there from Lou Grillo, who oversees that program, requesting that he be appointed. So was this still advertised?
It was still advertised because that was an open position. Unfortunately, I was not aware that we had another position open until Mr. Grillo pointed it out that we did.
Okay, so there's 1 position available, 1 position, 1 application received, and a letter of request from the director.
Yes, that's correct.
Okay. Move for approval.
All right, motion to approve Charles Sims. All in favor of the motion, say aye. Aye. Any opposed? The ayes have it. Charles Sims is approved.
Thank you.
All right. All right, now we will, we had 2 items from the consent agenda that were pulled, and item number 7B, Budget Amendment 16, Commissioner Wilburn.
Oh yeah, this one, I just wanted a little more explanation because it's such a large amount. The total is $12 million. There were some bigger ones in there, and the detail was a little different. The other budget amendment, I could follow a little better, but I wasn't sure, given that we're a new board, I'm assuming these things were approved by the previous board, and now this is just to kind of settle up the budget for the year. So specifically, where it says the 2.4 and the 2.2 transfer from Fund 10 and Fund 41, I looked through the budget and I couldn't find what's Fund 410 and Fund 41. So I just wanted a little more explanation on some of those bigger items.
410 and 440 and 41 are the same thing, it's just the 0 gets cut off. 410 is the capital investment fund. This is where we house the money for the larger projects in the county. In years past, you have adopted your capital improvement plan, and we have opened and closed new and old projects at the same time. But the magnitude of the amount of projects that we're doing right now, we have a budget amendment that was passed in July to open all the new projects. That was a little over $6 million. And this is closing the projects, the budget for the projects that have been completed as of June 30th, 2024.
Okay.
The transfers are basically our mechanism for funding the projects. We had to open, like I said, the new projects, so we had to fund those. And when you see these revenues and expenditures, they have to balance. So that's our mechanism of closing the budget and balancing that.
So, for example, the executive hangar project, that totaled 5.2 That was previously approved by the board.
Yes.
And rather than having a new line item for that project that's 5.2 that you spend down, you have like one pot for all the capital projects.
Well, the airport fund is a different pot. That's 400. And that's money that we received state, federal money, and we had a local match. And so that was a project that has been closed, and there are other projects that are currently going on. They're overlapping. So this is the budget. These are previous boards that allotted this amount of money to be spent on these projects. And the projects that were closed and done by June 30th, 2024 are closed. This budget is closed and it rolls back into that fund to support other projects at a later date.
Yeah, so primarily it was just because I didn't know the detail on those, account items and the amount, but I just wanted more background on it.
Any other questions? Okay.
All right, do I have a motion to approve the budget amendment?
So moved.
All right, any further discussion? All in favor, vote by saying aye. Aye. Any opposed? The ayes have it, motion's approved. Next, item 7E, reimbursement agreement for expenses related to closure of Country Club Road.
There were just a couple of things that seemed kind of open-ended to me. It expires in a year, right? And, it's capped at 200,000. So I was just curious to know what's the remedy if it continues beyond the year or if it exceeds 200,000.
Brandy, would you like to speak to this? I think she may be able to provide the specifics to a greater degree than I can.
So the monthly cost is gonna remain the same for the whole year. It's expected that they will have their road closure plan into DOT within a year. If not, we'll go back and negotiate another contract with them, but the monthly charges will remain the same for 12 months.
What are the monthly charges?
$18,623.16.
Any other questions? Do I have a motion to approve the agreement?
Move to approve.
All right, we have a motion to approve. Any discussion? All in favor, vote by saying aye. Aye. Any opposed? The ayes have it. Motion's been approved. Chairman's report. I did have the pleasure to attend a Farm Bureau Local Board of Directors meeting last week. Met with them and appreciate their hospitality. We covered many topics in the county, and I appreciate their invitation. County Manager.
Good morning. I would like to introduce our interim planning director who is with us this morning. Margaret Houth is in the audience. So she has been working with us for about a month on a part-time basis. We are getting ready to open recruitment again for a full-time planning director, but she is retired planning director after over 30 years working in the field, and we are very happy to have her with us.
And I'm very happy to be here. Appreciate the opportunity. Hope I can help.
Thank you.
Thank you. And then I also wanted to mention next week, the library will be closed from March 21st through March the 28th to move to install an enclosure and then relocate the North Carolina collection from the community room onto the floor of the library. During this time, we will be offering curbside pickup to the public. So members of the public are welcome to call the library directly to reserve materials or go online and reserve those through the Cardinal system. And those will be brought out to them next week if they stop by to pick them up.
Thank you. All right. Vice Chairman Thomas.
So Tuesday night, I had the pleasure of attending the veterans meeting on the wall that heals. One of the topics that's being discussed that needs to be in the public's knowledge is April the 29th. That's the day the wall comes in. It's going to be on a Tuesday afternoon. Starting at 1 o'clock, 501 will be shut down from the older Northern High School in Durham all the way to Moorhead Street in Person County. So you just need to make sure you're planning ahead on that day. Just know that road will be closed. No one will be allowed to pass. And on Wednesday, I had the privilege to go and speak at the Civics Academy. Miss Kim Strickland went on for the county, and it was a great turnout, and I want to thank her for giving me that opportunity to come and speak briefly. That's all I got.
All right, Commissioner Wilburn?
The North Carolina Association of County Commissioners had 2 steering committee meetings last week. One was for general government, and the highlight was about regional planning, working together as a region for water sewer planning, land use planning, based on watersheds. And the representative there was not from our COG, but he did talk about putting things in place at the COG level for those positions that are hard to find now, like planning directors and finance directors and those things that we, had seen posted time and again, to go through the COG and for those counties to be able to share resources with staffing for some of those. So I haven't talked to our CARTAR yet to know if they're doing anything like that. But they are encouraging that as an opportunity for counties that are struggling to find staffing at those levels. The other one was Tax and Finance Steering Committee. Kind of a little bit of overlap, but Catherine and I met with the field representative for Senator Tillis last week. And of course, Antoinetta had already gone and met with him face to face and shared some needs. And so we were just talking about some other things that could be done to support Person County that may not have a dollar amount attached to them, like continuing to support the federal programs that we need in Person County, that we benefit from in Person County. And so one thing that was said at the steering committee was specifically that Senator Tillis does not support tax exempt bonds. So they encouraged us, if we have any projects that we need to make his office aware of that we're dependent on here. So I think we can follow up with Mr. Finley, and then if you had any contacts that you made with his staff, we should be sure to let them know about that. And that was a recommendation. I was gonna ask for an update on the planning department, so I'm glad that you're here. I know there was no planning board meeting for February or March. Sorry, I'm losing my voice. So do we have any update on what the turnaround time is now for approvals from the time an application is submitted? I know there's some pending economic development stuff.
There are, and I believe that staff is working on 2 potential items for the April meetings. They've been working with 2 applicants and working through their applications and getting some more information from them. We do benefit from having Margaret in the office, as well as the continuing support through CARTAR COG for technical assistance from Ken Krulik. So we do have also the Peninsula at Hyco Lake subdivision has brought forth their plans, and they are moving towards having those recorded. So staff has been spending quite a bit of time with them on reviewing those final plans, and continuing to handle the day-to-day of applications coming in for permitting. So I do believe that we've had a consistent presence of staff in the office for the last few weeks. We've gotten through weather problems as well as sickness, so they are getting back into the groove and the workflow of being able to move those through on a more timely basis.
So how many days a week do we have additional support now?
So Margaret's here 3 days a week, Monday, Thursday, and Friday, and then Ken Krulik is in the office the majority of the day on Tuesdays and Wednesdays, but being with the COG, he is providing assistance to other jurisdictions as well, so his schedule does fluctuate based on the needs of others.
Okay. And then what's happening with the peer review that was requested for the reappraisal? I saw that they had 1,800 appeals, and then it said 500 were processed. So I didn't.
Right, so they're working through the informal appeal process now, and I have submitted a letter. I've worked through the process with NCACC to submit a formal request for the peer review, so the next step will be to schedule a meeting to outline the steps and the timeline that will take.
Okay, and then I just wanted to congratulate Larry Cole on being recognized as the Main Street champion at the Main Street Conference. He's well known for his contribution to our Christmas lights and Christmas parade, and he obviously does a lot more, and they're celebrating their 50th anniversary this year. at Furniture Mart. That's all I have.
Commissioner Royster.
Well, I attended before I went to Capitol Hill, the Rossburg Area Chamber of Commerce meetings. And there will be a ribbon cutting at Twine and Teak on March 20th. And I do see how you all already discussed some things that we had on our agenda in the meeting that I missed the last meeting. With the Person County Board of Health, I wanted to highlight some things for the community, given that Sherry had talked about the number of appeals and everything in the tax office. I can't talk this morning. During that meeting, Bonnie Holt shared that they've had this influx of calls with people regarding reappraisals, because they need to provide proof the property is not buildable with the appeals process, and they knew that they could not meet the March 1st deadline because of backlog, because of the number of calls they're getting. And with each of those, it's a $200 application fee with that. Also, for community's sake, it shared that the health department is offering express clinic services regarding STDs because of the amount of staff they have. They have express clinic services, which would free up time for staff to be able to serve other needs of the community. For that, with JCPC, they have, within that, we had 2 agencies, Roots and Wings and Youth Villages, had gone through monitoring. And what I wanted to highlight with that, with Roots and Wings, the number of programs that they're overseeing and how many youth and families that they're serving. And with just the juvenile community service and restitution program, they've served 20 youth so far, and their goal was 25, and they still have some months left. But that's like in addition to the other 3 programs where they're really busy with helping the youth in our community. And there will be a teen court summit the first weekend in April, where we have teens involved with youth with Roots and Wings. They will be going, and it will, again, the first weekend in April in Greensboro. And sometimes they will accept sponsorships. So if anyone in the community want to get with Ronnie Donovan to help these youth get there, but at the same time, it's just a good experience for youth to be the judge, the jury, the attorneys, all of that with their peers, and it's like a competition with other counties as well. I did have a meeting with Via Health, Elliott, but we had to reschedule due to illness, but our next regional meeting is in May. And I was excited to be able to attend the Civics Academy this past Thursday with Kim, when the topics were generally around health and human services. And it was just exciting to see how engaged our community was during that time and the information shared. One other thing I wanted to highlight when we talk about food insecurities in Person County, the Food Bank of Central and Eastern North Carolina, they are seeking to set up a food bank here in Person County. And this past Thursday morning at 10 in the middle of nowhere in Timberlake, 777 individuals were served. And I just thought that was significant because it's not in the center within the city limits, it's out Timberlake. And because of the number of people who participated or came out that needed help, they want to do this again on April 10th. And that information I can share with our county so that it will be on our platform so that more people will be informed. But I just thought it was significant that we served that 777 individuals on a Thursday morning came out because they needed food. And lastly, I represented the county at NACO, And while I was there, I did meet personally with Brad Knott, and he did highlight some things about Person County that he really appreciated and wants to come visit soon. And with each meeting, either with policy teams, I met Ted Budd, Tom Tillis, and Brad, of course, Congressman Knott personally, but I enjoyed talking to their policy teams because you had more time to share about the county. And what I highlighted with them were pretty much our needs, our goals, and good things that's happening here in Person County regarding our economic growth, infrastructure, the environment, health and human services, public safety and emergency services, and education. And the positive thing I took away from all of that was when I met with each group, they had things positive to say about our county. They all knew a little bit what was going on in Person County, so I told them, I said, well, I did my homework on y'all, and it seems like y'all done your homework on us too. But I just appreciate the opportunity to be able to do that, and hopefully some good things will come out of that. And when you mentioned with Senator Tillis's office, while I was sitting here, I received an email from one of his policy team members. So I'll look at that later. But yeah, they are working to put something together that's specifically for Person County that they would like to send to us to review.
Thank you. Chairman, I forgot to mention that I have a conflict with two of the boards that I'm appointed to. They meet on the same day at the same time, the Upper Neuse River Basin Association and the Extension Advisory Committee both meet on the third Wednesday, and their meeting times overlap. So if there's any commissioner that's interested in trading one that meets at a different time, I'm gonna have to figure out what to do about that to get representation.
Is there any?
So the Extension Advisory Committee meets downstairs, so that is local. The Upper Neuse River Basin Association meets in Butner, and that's about half a day. Once a quarter.
And they typically provide a link as well to be able to join virtually. I think there's a
They do
hybrid
have a
option.
link, but it's not really good, it's not really set up to be that way.
Yeah.
It's not good quality.
Right, I agree. It's
I think you participated by Zoom for the one I went to, and it didn't really seem like you were included in the meeting.
yeah, it is better to be there in person, but there is an opportunity to join remotely if it's difficult to get there for a specific meeting.
So the Extension Advisory meet on Wednesdays at
The third Wednesday, I think at 11 o'clock, and they provide lunch.
that's local. I may be able to do that
All
one.
right, you want?
Yeah.
All right, Madam Clerk, please note of the committee assignment change.
Yes, sir.
Trade or whatever, and just let me know.
Okay. All right. Now we will move into closed session number 1 per General Statute 143-318.11 for the purpose of discussing matters related to the location or expansion of industry or other business in the county, economic development with the following individuals permitted to attend: County Manager Catherine Cathy. Clerk by saying aye. Aye. Any opposed? The ayes have it. We're now in closed session. Okay, we are now back in open session. Does the board wish to take any action?
Mr. Attorney, can you state the form of the motion?
Yes, Madam Commissioner. The board has been approached regarding 211 Webb Street, a piece of property now owned by Daymark Services. And Daymark requests that the county relinquish its right of first offer over that property. And the proposal from staff is that the board grant to Madam Manager the authority to discuss this matter with the county attorney, and in negotiation with opposing parties, present a document to execute the release that will be signed by the board chair if it is so approved.
So moved.
All right, we have the motion. Any further discussion? Haven't heard none. All in favor, vote by saying aye. Aye. Any opposed? The ayes have it. Motion's approved. Do I have a motion to adjourn? All right, a motion. All in favor, vote by saying aye.
Aye.
Any opposed? The ayes have it. Meeting adjourned.